I just want to thank you and the Cape Breton Regional Chamber of Commerce for giving me this opportunity to talk to folks this morning about occupational health and safety. I'm very passionate about workplace health and safety. I was just thinking about the first fatality that I was ever involved in. I was quite young. I was about 23 years old, and I had witnessed a double fatality, and just that's always been in my mind that I don't want anyone to ever have to experience that in their work life. So as it says there on the slide, my name is Blaise MacNeil. I'm one of two safety advisors with the Department of Labor, Skills, and Immigration. I work for the safety branch, and I'm actually specifically I'm attached to what's called the Awareness and Outreach Unit. So there's two of us across the province. There's myself here. I'm located in Sydney, and the other safety advisor is Sterling Kendall, and he's located in our Dartmouth office. So just to give you a little bit about my background, so prior to becoming a safety advisor, and this role was created back in 2022 as sort of a response to the pandemic, which is still kind of fresh in our minds. We realized that during the pandemic, particularly small businesses had a really challenge to try and sort of comply with that seemed to be never ending, ever changing, should say, public health order. So that was one of our focus areas is our small to medium sized businesses. So prior to becoming a safety advisor, I worked as an occupational health and safety officer for about 16 years. So I would inspect retail spaces, healthcare facilities, construction sites, you name it. I've pretty much seen it all. So I just want to give you a little bit about my background, so you understand where I'm coming from. So the objectives of the webinar this morning, so one is to review the needs and content of an occupational health and safety policy and an occupational health and safety program. Number two is to help you understand the role of joint occupational health and safety committees and health and safety representatives and understand the functions of each. And the third objective is to learn about some of the free resources, training, and information that is available to employers, employees, committee members, health and safety representatives through the safety branch. So first, I'm going to talk a little bit about the internal responsibility system. This is the foundation of the Occupational Health and Safety Act here in Nova Scotia. And in fact, it's the foundation of all occupational health and safety acts right across Canada. So whether you work in Newfoundland and Labrador or you work in British Columbia, you're going to hear folks talk about what's called the internal responsibility system. So we are the only jurisdiction in Canada, however, that actually has the internal responsibility system explicitly defined within our act itself. So basically what it means is the internal responsibility system says that everyone in the workplace shares responsibility. So it's not just your supervisor or the employer or managers or anyone at that level that's responsible for health and safety. Everybody is responsible for health and safety. And that responsibility is based on your authority and your ability. So whether you are sort of a frontline worker or you're a foreperson or a manager or a CEO, that's going to determine what your authority is and what your abilities are. And so typically those things are found in job descriptions. So that's a good area to look at when you're trying to figure out, well, what kind of abilities should I have or what sort of expectations should I have by my employer. And that's kind of what it comes down to is, it's about expectations that employees have of their employer and also the expectations that the employers have of their employees. So the internal responsibility system, it provides a framework for participation, communication, and refusal of unsafe work. And part of that participation, I'll talk a little bit more about joint occupational health and safety committees and health and safety representatives and ways that you can communicate health and safety information in your workplace. And the last point I want to make is to talk about or to mention that the safety branch does not make workplaces safe, contrary to what a lot of people believe. They think that, as I mentioned before, my previous role as an inspector, they thought that, we would go to a workplace, we would do an inspection and everything's good. Whatever they found, they point out to us. And if they didn't find anything, they would let us know for sure. But, we can't possibly be in every workplace in Nova Scotia. There's 35,000 businesses in Nova Scotia. We have about maybe 35 inspectors, give or take a few. So you do the math. It's just impossible for us to be there, nor should we, because again, the people who work in those workplaces, they need to have buy-in. They need to have, they're the people who know the workplaces the best. Our inspectors don't know everything about every potential industry and sector out there. So it's really important that people understand it's really your responsibility. We're just basically there to sort of verify that you are complying with the act and regulations and to help you out. And again, something else I want to emphasize is that we're not just out there issuing orders and issuing fines and taking people to court and prosecuting them. We are there to help. My biggest role within awareness and outreach, 95% of my work is about awareness and outreach. I did some of that as an inspector, but that wasn't my main role. But that is my main focus as a safety advisor. So I'm going to touch on two of the most important roles under the Occupational Health and Safety Act. There are others, but the two I'm going to focus on this morning is the employer, which is under Section 13 of the Occupational Health and Safety Act, and the employee section, which is under Section 17. There are other folks who are what we call workplace parties who are listed in the Occupational Health and Safety Act. We have contractors, constructors, owners, architects, engineers, suppliers, all these other what we call workplace parties who potentially could affect health and safety in your workplace are named in the act. But as I mentioned, I'm just going to talk about the employer and employee section. So the employers, and again, this is a brief outline of the responsibilities and the duties of the employer, but basically it says that the employer must ensure the health and safety of persons at the workplace. And I have there everyone, but if you look at the act, it actually specifically says persons. And the reason for that is because it's not just about employees that you need to be looking out for. It's people that potentially could be affected by what you do. So, customers could be affected by the conditions in your workplace. People just could have, particularly at a construction site, somebody walking by and you're doing construction, say downtown Sydney, things you could be doing there could affect people just walking by. So it's really important that employers understand this, that it's persons out into the workplace that you need to look out for. So some of those precautions that an employer must take are ensuring the health and safety of the workplace, so sort of in general, provide and maintain equipment, machine, and tools, provide safety instruction and training. And a little point I want to make about instruction training is not only providing it, but making sure that employees use it. And the reason why I say that is because I've encountered, and again, I'm going to sort of pick on construction a little bit here. I would go to a work site, and one of the requirements for a construction site is when you're working at height, you need to have fall protection training. So I would go and ask them, can you please show me your fall protection card, and say, oh yeah, here it is. I have it here in my pocket, and I just took it last year. As you can see the date and the expiry date and what have you. But yet when I arrived there, they were working above 10 feet and they had no fall protection in place. So it's really important that it's not only you're giving your employees training, just make sure that they're actually applying it to the situation at hand at the workplace. Employers also need to make sure employees are familiar with hazards in the workplace, and that's the biggest thing here. If you don't take away anything else from the session or any of the sessions, is that's what workplace health and safety is about. It's about recognizing hazards. It's not just about recognizing physical hazards. There's all kinds of different hazards in a workplace, whether there's physical hazards, chemical hazards, biological hazards, and we all know biological hazards now after going through a pandemic. Even psychological hazards. That's one that's coming up. That's going to be a new topic that's going to be front of mind within the next few years here in Nova Scotia. Also ensuring that employers are not exposed to health and safety hazards in the workplace. And some of the duties of the employer: to cooperate with your health and safety committee if you have one in your workplace, and I'll talk about where they're required, or the health and safety representative, cooperating with the Department of Labor, Skills and Immigration and the officers, of course, complying with the Act and regulations, and developing an occupational health and safety policy and or program where required. And I'll talk about those requirements. I'll make mention too, for everyone attending, that I will be taking questions at the end of the session. So just hold your questions till the end, please. So the employee section, section 17, again, same thing. Employees must take precautions to ensure the health and safety of others and themselves. And when it says here, take precautions, that's every precaution. And it's not just about looking after you, it's also looking after your coworkers and people around the workplace as well. So it's really important that you understand what those roles are, you understand what are hazards and what are the things that you can do, what reasonable, and that's where it talks about as well in the legislation, talks about reasonable precautions. We're not looking for superhuman effort here. We're looking just for what a reasonable person would be expected to do in that particular circumstance. So same thing, employees need to make sure they cooperate with your health and safety committees or health and safety representatives, whoever's in your workplace, your fellow employees, and the Department of Labor, Skills and Immigration, and of course the OSH officers as well. ensure all protective devices, equipment, and or clothing are properly used. And same thing, they need to make sure that, if you don't know how to use it, you make sure you speak up. Again, general, duty clause here is complying with the act and the regulations. And the last thing, and the sort of the most important thing, is reporting all hazards immediately to your supervisor. So it's really important that employees understand if you see something that you believe is a hazard, and not everyone, sees things the same. Somebody might look at something or some situation and say, "Oh, that's fine," and somebody else like, "No, no, no, there's a hazard because of this or that." So it's really important you speak up. You need to bring it forward to your supervisor. If you don't feel comfortable in doing that, and that's one of the reasons why we have health and safety committees and health and safety representatives, is that you can bring it to one of those people. So depending on the size of your workplace, you can bring it to your health and safety representative, or you're a member of your health and safety committee, or as a last resort, you can always contact the Department of Labor, Skills and Immigration, in particular the Occupational Health and Safety Branch. So, and I'll talk a little bit about some of that contact information. But it's again really important that employees understand, report hazards immediately, because we don't want that hazard to be sort of, keep it to yourself, and then next thing you know, something that would seem minor today becomes something much more serious, or maybe even a fatality later on. So it's really important that people understand there are different ways that you can report hazards in your workplace. And that's part of the internal responsibility system. You need to report it to your supervisor first, because you want to give them the opportunity to make things right. Don't go, still do it internally. Go to your supervisor first, because they sort of oversee your work on a sort of semi-regular or daily basis. If you don't get any satisfaction there, then go to the next level of your committee or rep, and last resort should be the Department of Labor, Skills and Immigration. So next, I'm going to talk about occupational health and safety policies and an occupational health and safety program. Oh, here we go. Okay. So what is a policy? So basically, a policy is sort of a general guideline. So it kind of tells you sort of the why of what we're doing. And if you look at the Occupational Health and Safety Act, the only sort of policy in the act that is mentioned is what's called an occupational health and safety policy. And that policy basically, policies are used to communicate the values, philosophy, and culture of your organization. It sort of outlines the expectations of the employer and the employees. And as I mentioned before, it tells, sort of demonstrates the why behind the action. So around occupational health and safety, this is why we're doing that. So this is sort of an example of a occupational health and safety policy. This actually comes from one of the manuals that was developed as a partnership with the Spring Garden Road Retail Business Association and our department through the Minister's Education Trust Fund. And I'll go into a little bit more detail about that manual in a few slides. So looking at an occupational health and safety policy, this falls under Section 27 of the Occupational Health and Safety Act. So what the Act says is when you have 5 or more employees who are regularly employed, and when we say regularly employed, this is defined as well. So it's really important that you kind of become familiar with the Act. And of course, everyone should have a copy posted in your workplaces, and I'm sure you all do. So basically, when we talk about regularly employed, that means somebody who is in a period of employment for at least 4 weeks. So basically, it means that if you have that 5 or more, you shall prepare a written occupational health and safety policy, and you have to review it annually. And so the requirements for an occupational health and safety policy, again, these are just the bare minimum requirements. Basically, your health and safety policy must express the employer's commitment to health and safety and include your reasons for commitment to health and safety, the commitment of the employer to cooperate with the employees in pursuing occupational health and safety. And the last point to make is responsibility of the employer, supervisors, and other employees in fulfilling the required commitment. So again, when you look at a policy is sort of a very sort of general document, very broad. Most policies are probably maybe a page or 2 pages at the most long. So very sort of general statements, but sort of sets the framework for, in this case, occupational health and safety. So let's go and we'll take a look at some other policies. So I have some samples here. Again, there's 3 there. The emergency preparedness policy, an ergonomics policy, a drug and alcohol policy, and the last one there is a harassment policy. And as I mentioned, the Act, sets the minimum standard. So anything you read in the Act or the regulations, those are the minimum standard. And we certainly encourage employees to exceed the minimum standard. So, as I said, it talks about a health and safety policy, but there's nothing in there that talks about emergency preparedness specifically. But again, look at your workplace and how many times have you had maybe the power go out in your workplace, or maybe you've had a flood in your workplace, or maybe even a bomb threat. So it's really important that you look at these. Okay, these are potential hazards for my workplace. What sort of policy, what sort of general guidelines do I need to give myself and my employees around these particular situations? So again, those first three policies, the emergency preparedness one, the ergonomics one, and the drug and alcohol policy, these are all samples that are in the safety manual that I mentioned. And this last policy here, the sample harassment policy, and as I mentioned before, harassment and bullying is going to be becoming the forefront in Nova Scotia as far as having some sort of legislation or regulations in place. We did a number of engagement sessions that ended at the end of last year, so December of 2023. And so the department is just putting together sort of a what we heard report, and that'll be coming out soon. And basically to help inform us, so what are we going to have in place? Are we going to incorporate harassment and bullying into our already existing violence regulations that we already have here in Nova Scotia? We've had those now since 2007. Or are we going to have a totally new regulation? What's that going to look like? So, and it's really going to sort of fall under sort of the broad term of psychological hazards, because harassment, bullying, and even in violence could be considered a psychological hazard. So you'll see throughout my presentation, I do like QR codes. So at the bottom of that slide there, if you scan that QR code, that'll actually take you to it's called Nova Scotia Works. It's called Welcoming Workplaces. So if you scan that QR code, if you open up the camera function on your phone, you can scan that, and that'll take you to the Nova Scotia Works and Welcoming Workplaces. And there's templates and samples of other documents there as well. So I encourage you to do that. So the next thing we're going to talk about is the components of an occupational health and safety program. So the requirement for a program is if you have 20 or more employees employed on a regular basis, and we talked before about what a regularly employed means, you must prepare and maintain a written occupational health and safety program. And I sort of emphasize maintain because I've seen far too many programs in my years as an occupational health and safety officer being developed by workplaces, and then they put them up on the shelf. They either pay a consultant, to lots of money to come in and do this for them, and then they never open it up again. So it's really important as an employer you understand that it's for your benefit. It's not for no one else's benefit other than yours. And obviously, of course, if an inspector comes and they know the size of your workplace and they're there to do an inspection, they're certainly going to ask you for a copy of your program. So it's really important you have it readily accessible. But so basically, there's sort of 8 components to an occupational health and safety program. The first one, in no particular order, but at the top there is training and supervision of employees, preparing written work procedures as they relate to health and safety for your workplace, establishing a joint occupational health and safety committee or a health and safety representative, establishing a hazard identification program, monitoring the follow-up and control of hazards in your workplace, establishing an accident investigation system, maintaining records and statistics, and monitoring how the program is implemented and performs. So as I mentioned, I probably should have mentioned with respect to developing the policies and even with developing the program, it's really important that you engage your employees in doing this work, because these are the folks that this is going to affect. So like anything, I'm sure some of you may have experienced this in your previous work where you have an employer and they sort of here's a policy or procedure and this is what you're going to do, and there's it's sort of coming down as being imposed on you. There's really no buy-in. You weren't consulted, you never provided any input. You're the people doing the work at the front lines, and there's things in here, well, yeah, this really doesn't work. It might look good in theory, but in practicality, no, this isn't going to work. So it's really important that you involve your employees in this process. You can, and what that involvement entails is really up to you as the employer, but it's really important that you do get them involved. And as I just want to mention, the biggest thing around workplace health and safety is about hazards. It's about recognizing hazards, um, you know, recognizing that something is a hazard, and then, okay, what can we do to control that hazard? So can we eliminate it? That would be great. That's sort of what we call the hierarchy of controls in sort of the safety profession or the safety world is, if you can eliminate a hazard, that would be great. If you can't, then, can we minimize it somehow? Can we reduce it some way? Can we put some engineering controls in place so we can sort of separate the hazard from the people in our workplace? So we keep that sort of a physical separation or barrier. That's great too. So it's really important that people understand that there are hazards in every workplace. It doesn't matter whether you're working in an office setting, you work in healthcare, a construction site, doesn't matter. There are hazards everywhere. Some of them are very acute, so they can happen quite quickly. Particularly, again, I'm going to pick on construction. Construction, you're working at height. You take a misstep, if you're not tied off or don't have any fall protection in place, you potentially could fall quite a distance and either break a limb or could be a fatality. Same thing in an office setting. If you're doing repetitive, typing or repetitive work, or even in a manufacturing facility where you're doing repetitive movements every day for several hours a day, you can develop injuries. It may not be imminent, it may not be acute, but over the course of many years, many months or many years, you can develop injuries. So it's really important people understand that, and even things like biological. We experienced that with the pandemic, right? So taking reasonable precautions like hand sanitizers and making sure people wash hands and wearing masks, and even people staying home from work. When you're sick, don't be a hero. Don't think that I want to get the record for the person who's never lost a day of work at work. Like, no, if you're sick, stay home. So those are just some of the things like hazards that should be part of your health and safety program. And again, I want to emphasize that it's really important that you involve your employees in developing policies in your program. So as I mentioned, we have a couple of documents here. So on the left-hand side, and again, you'll see the QR codes there that'll bring you to those documents. So the first one on the left is the safety manual. As I mentioned, that was developed. So basically, the safety manual, it provides you instructions on a variety of topics, such as what is required by law to ensure workplace safety, along with templates of necessary safety documentation. The manual is designed to easy to be used, will provide new and existing businesses with the general knowledge of what is expected of them as an employer and what the rights and responsibilities employees are. So as I mentioned, the safety manual was created by the Spring Garden Business Area Association with funding from the Occupational Health and Safety Education Trust Fund. And that manual is actually available in English and in French. And you can find that on our publications website. So if you go to our website, where on the left-hand side is publications, you'll find that under guidelines and other documents. And then the other document that you see there, that's called the Small Business Safety Toolkit. So this will help you put a health and safety system in place to protect your workers and yourself from injury and illness. And that's what this is really all about. Because we want you to stay in business. We want you to be successful. And, compared to larger businesses, if you have a serious injury or, heaven forbid, a fatality, that could be the end of your business. So it's really important for small businesses in particular that you understand your rights, or so your roles and your duties as an employer and rights and responsibilities as employees. So learn your basic duties and responsibilities under the Occupational Health and Safety Act and regulations, and help you understand how health and safety plays a role in the day-to-day operation of your business. So for health and safety purposes, we define a small business as one with 19 or fewer employees, no matter your payroll or how much annual revenue you have. So next, I'm going to talk about joint occupational health and safety committees and health and safety representatives. So why are they important? So, well, they're part of your system, and that's what this is about. If you look at a workplace, it's a system of people working, it's a system of processes, it could be a system of tools, of equipment, again, depending on what sector you belong to, whether you're retail or manufacturer or construction site or healthcare. There's all kinds of bits and pieces and parts that are moving every day. And so that's what it is. It's a system of all these things in place. So it's really important that people understand, as I said before, regardless of what sector you're in, there are hazards in every workplace. Health and safety representatives help you to identify those hazards. So it's not just about the employees, doing a particular task or working in a particular area of your workplace. The health and safety reps and your Josh, I'm going to use the acronym Josh, are sort of hopefully will get some extra training, and so they'll have a keener eye in identifying hazards, and that's part of their role. Is the folks who are either your rep or on your committee are ones who sort of express a sort of over and above interest in occupational health and safety. They want to help, to make sure that everyone should be certainly working to make sure that they identify hazards and keeping everyone healthy and safe. But your committee members and your health and safety representatives just have sort of a more keen interest. So, but they're not the only ones. So I just want to emphasize that. Not everyone is to go to the rep in the committee. It's not their sole responsibility, but they're certainly to help sort of, keep people on task and make sure that you're doing what you should do as far as identifying hazards and minimizing them and putting controls in place. They are critical check and balance. So they're making sure that, if you have a program in your place, that you're following that. So if you're supposed to be doing inspections, say once a month, that you're doing that you're making sure that you're doing your inspections, that, your first aid kit is up to snuff, that you have all the supplies that you need in it, that you have the required number of first aid attendants in your workplace, those sorts of things, making sure you even have a health and safety bulletin board, that you have a copy of the act posted, that you get the names of the Josh members or the health and safety representative there posted, where's our first aid kit, those sorts of things. And then the last point I want to make is, and I sort of mentioned it a couple of seconds ago, is that the health and safety committee and the health and safety representatives are not the doers of health and safety. You don't just kind of push it off and say, okay, I'm the employer. Okay, Josh, okay, health and safety rep, you folks are doing health and safety. That's I'm washing my hands of that. That's not the case at all. You go back to what I said before about the internal responsibility system. Everybody is responsible for occupational health and safety. The Josh committee and the health and safety representative are there basically to audit, to sort of make sure that everyone is doing what they're supposed to be doing. So, if you look at and I didn't go into great detail about this today, that could be a subject for another webinar. So if you're interested in doing that, let Megan know. We can do something about supervisors. We talk about supervisors. That terminology is mentioned in the Act and in the regulations in several different places, but in Nova Scotia, we don't specifically define who a supervisor is, but they have a critical role because supervisors are sort of the go-between between the employer and employees. So they sort of need to walk the talk and demonstrate health and safety and demonstrate leadership as far as making sure that that we have procedures in place, that we're following that health and safety policy. So it's really important that folks understand that everyone's responsible for health and safety. The Josh committee members and the health and safety representatives are not the doers. They're basically there to sort of audit, sort of the overseers, to sort of the watchdog, to make sure that everyone else is carrying out their roles and responsibilities with respect to health and safety. So I'll talk a little bit about the requirements for health and safety representatives and joint occupational health and safety committees. So when do you have to have a health and safety representative? So when you have between 5 and 19 persons who are regularly employed at your workplace, that's when you require a health and safety representative. Now, I'm going to say this again, and I'll say this a few times. That's what the Act says. That's the minimum standard. If you don't have at least 5 employees, you can still have a health and safety representative. And I encourage you to do that because as an employer, there's an extra set of ears and eyes at your workplace to help you identify hazards in your workplace. Otherwise, you're kind of going it alone. And I don't know how many employers have a background in health and safety. It's not something that would require. But again, if you don't, then you need to sort of bring resources to bear to help you understand, okay, what are the hazards in my manufacturing facility, or what are the hazards at my construction site, or what are the hazards in my office? So it's really important that it's always great to have somebody there and like that sort of fresh eyes of perspective. So even if you don't have at least 5 employees, I really encourage you to have a health and safety representative to help you out in your workplace. And also says here in the legislation, when there's 5 to 19 persons that are regularly employed at a construction project, you have to have a health and safety representative. And you can have several different sort of subcontractors on a workplace. So, if you have at least 5 employees, and each one of those subs may have their own rep, but also in total on that whole project, and that kind of leads me to the next slide, you could also, there would be a requirement there to have a committee. The next one point there is if our executive director of our occupational health and safety division issues in order for you to have the health and safety representative, then you have to have one. And sort of the final point is the health and safety representative is not to be connected to management of the workplace. So a health and safety representative in a workplace is to be selected by the employees. So your role as an employer is to bring your employees together to say, hey, we're going to have a health and safety representative here in our workplace. You folks need to pick who it is. So if somebody, usually there's somebody who's keen, who's really interested in being, health and safety representative. They're really keen in knowing about and learning about health and safety, and they want everyone to be safe. Typically, you'd have somebody who will step and say, yeah, I volunteer. If not, maybe, you do it by vote, but typically you want somebody to be there who wants to be there. You don't want someone to be voluntold by the other employees. And you want it to convey it that this is an important role and you take this seriously, that it's not about somebody snitching on people or being a rat. And trust me, I've heard these terms used over the years, and it really kind of irks me when I hear people saying that. It's not about snitching on people. It's about keeping people healthy and safe. Because you know what? The expectation of your brothers and your sisters and your nieces and nephews, your pets, your husbands, your wives, your partners, is that you come home healthy and safe at the end of the day. That's their expectations. And that's what this is about, is making sure that people are healthy and safe. You have the right to be healthy and safe and come home healthy and safe at the end of the day. So next I'm going to talk about when is a JOSH committee required. So a joint occupational health and safety committee is required when 20 or more persons are regularly employed at a workplace. So you have 20 or more, you have to have a committee in place. Again, same, and the second point there is about if you have 20 or more persons regularly employed at a construction project, you have to have a committee, or sorry, yes, you have to have a committee in place. The next point is if the executive director of the Occupational Health and Safety Division orders it, then you have to have a committee. And the last thing is the employer is responsible for forming the committee. So some points about that is, so in this case, the employer is responsible. And this is part of the employer's responsibility to make sure that health and safety is protected, that employees' health and safety and their health and safety is protected as well, because employers can also be employees of a company, depending on your role. But it's also part of the employee's right to participate. So that applies to being a health and safety representative too. So that's one of the three rights, and I believe I covered that back in the previous session about the rights and responsibilities under the OHS Act, the right to know, the right to participate, and the right to refuse. So the right to participate is basically you can participate as a health and safety committee member or as a health and safety representative in your workplace. Again, part of that participation is to protect not only your health and safety, but that of other employees at the workplace. And the last point about your health and safety committee is that at least 50% of the committee needs to be non-management. So if you decide, and there's nothing in the act that says, the minimum required number of people or members of a committee, but say you decide to have a committee made up of 6 people. Well, you can't have 4 of them are management and 2 are non-management. That's not going to work, because if you look at the intent of it, if you decide that any matters, any issues that you're going to discuss within your committee are going to be by vote, then potentially, if you always vote on things, management, not to say that every management is like this, but they could potentially vote everything down all the time, and then you've never get anything done. The committee would be dysfunctional. So it's intentional in the act that it says at least 50% of the committee has to be non-management. So you can't have more management reps than non-management on your committee. So we'll talk a little bit about the functions of JOSH committees and health and safety representatives. So as mentioned before, it's not only the function of the JOSH or the health and safety representatives, but a function of everyone is to identify hazards to health and safety in your workplace. Really important that people get instruction, training, understanding of what are hazards, the different types of hazards, as I mentioned, the physical, the biological, the chemical, the psychological, that are out there in the workplace. Auditing of compliance with health and safety requirements. So it's before, there's sort of the watchdogs, the overseers of your health and safety program or of your health and safety system within your workplace. So they're going to make sure that people are sort of carrying out their duties the way they should. Investigating and prompt disposition of matters and complaints. So if there's any injuries at your workplace or any complaints at all at your workplace, they're going to As I mentioned before, any concerns that you have as an employee, you need to bring it to your supervisor immediately. Bring it to your supervisor, give them an opportunity to make it right, give them a reasonable amount of time to make it right, depending on what the matter is. If you don't get any satisfaction there, then you take it to the next level, which is your health and safety committee member or health and safety representative. Finally, if you don't get any satisfaction there, then you take it to the Department of Labor. So these folks also participate in inspections, inquiries, and investigations. So if an occupational health and safety officer decides to come to your workplace to do an inspection, and there's a variety of reasons why inspectors may come to your workplace, these folks have the right to participate in those inspections as well. They're there to sort of, again, it's an open and transparent process. So typically when an inspection is done by an OSHA officer, you'll have somebody from management and somebody from non-management. Typically it will be a JOSH committee member or a health and safety rep accompany them during the inspection so that they can see and hear what the OHS officer is talking to management about. They will advise on an individual protective devices, equipment, and clothing. They also advise on a material or what's called safety data sheets. So under the WHMIS regulations, that's something that one of the roles of the health and safety committee members and rep is to look at those and say, okay, do we need to get new safety data sheets? Are some of these outdated? Do we have new chemicals on our work site that we'd have to get sheets for? So that's part of their role as well. They help to advise the employer regarding a policy or your health and safety program. They do investigate work refusals. The only difference between a joint occupational health and safety committee investigating work refusal and a health and safety representative investigating work refusal is that the health and safety representative does not have the ability to make a decision as to whether an employee should go back to work or not. A JOSH committee does. So basically, it says in the Act, with any complaint or concern, you sort of escalate it through the supervisor, committee, or health and safety rep, and then to the Department of Labor. The committee is the only sort of bodies because there's more than one. With a health and safety rep is typically one person. They can't possibly make that decision. They can't. It has to be sort of a unanimous decision by more than one. So that really only applies to as far as an employee going back to work after work refusal. That's a decision of a committee member of the JOSH committee. And the last point I want to make is maintaining records and minutes of committee meetings. And again, this only applies to joint occupational health and safety committees because you don't have, a committee of one. Like the health and safety representative doesn't have meetings with itself. So really, it's just the JOSH committees that meet and need to maintain records of the meetings and any decisions that they make. And I will talk a little bit about later on under the tools and resources. There's some really good training courses that joint occupational health and safety committee members and health and safety representatives can take. So now I'm going to move on to the tools and resources, some of the practical stuff from this webinar. So here's our website address is novascotia.ca/LAE/health and safety. And this top banner here that you'll see, actually, I don't know if you can see that. I'm going to use a laser pointer. So up here with this top arrow, this yellow arrow, that'll bring you to our technical safety website. And that has a lot of our videos and other documents that we have in several different languages. And I'll talk about that in the next slide. And over here in the left-hand margin is some links to our publications that I mentioned earlier, as well as our training link here. And there's also this training link here to some training that I'm going to talk about. So we do have multi-language resources. As you can see, we have, so these two cards on the end are what we call RAC cards. They're around technical safety. This is around safety in an elevator. That falls under our technical safety folks. And here's about fall protection training. And there's our contact information for the safety branch. These are what we call our rights and responsibilities wallet cards. So on one side, it talks about your responsibilities. And on the other side, it's about your rights. And then on the flip side, on the back side of the card, it has our contact information. So our toll-free number and our email address. They're just a really handy little card that you can give out to employees so they can a quick reference to that information. And as you can see here, all of this information you see here are in 10 different languages. So we have English, French, Arabic, Hindi, Mi'kmaq, Portuguese, Russian, Chinese, Spanish, and Ukrainian. And here's some brochures that we've just revised. They were sort of outdated, so we've decided to do those this year. So we have one brochure when an occupational health and safety officer visits a workplace, how to develop a policy and a program. your rights and responsibilities, and the internal responsibility system. And to go along with two of these brochures, this one here, What to Expect When an OHS Officer Visits, we have a 6-minute video that's available through that technical safety website that I mentioned in the previous slide, that link that goes along with this brochure. And then we have a 2-minute video that's available, that's closed captioned in 10 different languages. It's available on YouTube that goes along with the internal responsibility system. So that could be part of a training package that maybe you want to put together for your employees, that you provide them with, a copy of the brochure, as well as part of your safety orientation or job orientation to your workplace. You provide them with, viewing of the videos as well. We also published a couple of guides. This one here was very popular during the pandemic, was the Employer's Guide for Communicable Diseases. That's available both in English and French, and it's still available because, the COVID's not the only communicable disease out there. There are other communicable diseases. It's really important for workplaces to understand that and to be prepared for, in the case of an outbreak at your workplace. And then we also have the Workplace First Aid Guide. The first aid regulations were changed in June of 2023. And so we have this guide here to help you understand, what are the requirements for your kits and what are the requirements for training. And this is now, the requirements follow the national standard, which is right across Canada. So whether you're working in Newfoundland, Labrador, or British Columbia, your first aid kit and your first aid training are identical. And if you want to find these guides, you can use the camera function on your phone and scan this QR code. Now, some other refresh guides. This is one we just put out now. It's called Assessing the Risk of Workplace Violence. It's available on our publications page. And there's a form there. It's included in the guide, but there's also a separate form that you can use to help you sort of do the assessment. And we have a new guide that's come out, revised. This is on joint occupational health and safety committees and health and safety representatives. My practical guide, that's not out. It's going through the review process now. It's in the sort of the final stages, so it'll be coming up shortly. But you can go to this QR code here to get a copy of those guides. And here I just want to show you a short little video.
When you're stepping up safely for your job, use the NovaSafe app. Safety information made simple. A message from the Government of Nova Scotia.
Oh, you're still on mute there, Blaise.
Thank you very much for that, Megan. Sorry about that. I was taking a swig of my tea. Yeah, so sorry, there's the website address for our NovaSafe. So it's basically it's a mobile friendly website. We call it an application. It is an application, but it's not like an app that you can go to the App Store to get. So the only way to get it is to either go to this URL or to scan this QR code with your phone. And basically what it does, it provides plain language summaries of the different topics with respect to health and safety in Nova Scotia. It gives you definitions. It gives you direct links to the legislation. It provides additional resources as well. So as you see from this slide here, this is sort of what it would look like either on your phone. It could be on a mobile phone, or it could be on a tablet, or it could be on a desktop. So it'll give you the summary of the topic. So the example here is, the person looked up a safety program. It'll go. There's another link there for the specific legislation that applies to the topic of safety program. And then the final tab is a number of resources that are applicable to that particular topic. So it's a really great resource to have because everyone seems to have one of these, a mobile phone at least. It's great to have that right in your pocket. As long as you have access to the internet, you can access any topic at all. Right now, I shouldn't say any topic. Right now, we have about 33 different topics with regard to health and safety. The newest topic we put in there is around harassment. Because again, as I mentioned, that's something that's going to be up and coming here in Nova Scotia with potentially new legislation. And we're adding different topics, a bunch of different topics every year. So this year we're adding another 16 topics. So I really encourage you to to add that application to your mobile phone or your mobile device and to set up the tile so that you have easy access to it. So here's some information on some free training information and instructions. So we have an agreement with the Canadian Centre for Occupational Health and Safety. So all Nova Scotians can take up to 5 courses free every year through CCOHS. Right now we have about 32 courses that are available online. They're done at your own pace. They're all done virtually. They're not in-person courses. And when you complete those courses through CCOHS, you will get what's called a certificate of completion, just to show that you've taken that course. So there are other courses there. They have probably over 100 courses available, but just the ones that we have there are the 32 ones that are free. So if there's other courses that you're interested in, and they vary in price and how long they take to complete. The other course that we have is Women's Online Training. So this is available free through Skills Online NS. They have a number of other different courses that you can complete. Some of them are, and they're not just health and safety related. They do have ones on like leadership, for example, project management, communication, and communication is so important with respect to workplace health and safety. So I encourage you to check those out as well. This is one course. This is the newest course that we have available through Skills Online Nova Scotia. This is a course that was developed in collaboration with our department and the Nova Scotia Federation of Labour. It's called the New and Vulnerable Worker Safety course. So this course will take you about 3 hours to complete, and there's 5 modules there. So as you can see, Intro to OSH roles and responsibilities, OSH systems and processes, high-risk hazards, and the last one is what I really like, is occupation-specific information. There's about 16 different occupations that are listed here in that last module. So you get to click on different occupations and to see what the hazards are and what are some of the controls you can put in place. So that's one part of that. I really like that course. So I encourage you to take that, and there's the QR code that you can scan to take you to that course. Same thing with this course. When you complete the course or any courses with Skills Online, you get a certificate of completion, and you also have the ability as an employer to be able to track your employees' training through Skills Online as well. And here's some information about the Education Trust Fund that I mentioned. That's how that manual is developed. So as an organization, if the chamber has an idea of something that's health and safety related that would really benefit all of your members, I really encourage you to scan this QR code. That'll take you to the application process, and it'll let you know sort of what the criteria is to apply for funding. And as you can see, I really like QR codes because everyone seems to have a mobile phone. So this code here will take you to our Signal. This is a quarterly newsletter that we put out. So we just put one out. There will be another one coming up for the summer, I believe, in a few weeks. Really great resource because it sort of summarizes some of our statistics from the past year on the number of inspections, different sectors we've been involved in, some different topics. So if you're looking for maybe a toolbox talk or something around safety for your workplace, it's a great resource to access. And this QR code here up at the top right is a way to get on our safety branch contact list, which basically will enable you to get notifications. So some of these notifications that you see here, like bulletins, notices, alerts, and directives. So depending on your sector, if there's something out there that maybe it's about a piece of equipment, or there's a recall or something just an alert about maybe a different safety practice that you're not aware of, you'll be notified about those by getting in touch with us and getting on our contact list, as well as things like our the engagement sessions that we did about harassment and bullying back in December. People were notified about those to our contact list as well. And here's how to get in contact with us for more information. So there's our website address at the top. Work Safe for Life. This is a collaboration between us and the Workers' Compensation Board. There's lots of other great health and safety information and videos available there. There's the URL for our NovaSafe web application. There's a link to our YouTube page, and that'll basically have those internal responsibility system videos, so 2-minute videos that are available in 9 different closed caption languages. And finally, if you use X, there's how to get in touch or to follow us on X. And the last thing I want to mention is our Make the Right Call. So this campaign has been going on since, I believe, 2021. So if you, it's basically if you have a safety concern about whether it's your workplace or you're out and about and you see another workplace, you have concerns about health and safety there, or if you're in a public place and anything related to technical safety, you can contact the safety branch either by contacting us through our toll-free number, 1-800-9-LABOR, or sending us an email to safetybranch@novascotia.ca. You can scan that QR code there as well to learn more about Make the Right Call. It's available 24 hours a day, 7 days a week. It's 100% confidential. We don't typically ask for your name or a contact number. The only reason why you may be asked for that information, because I know as an OSHA officer, we rely on, if somebody's calling to complain about something that may be an imminent hazard, as much information as we can get, the better, so we know specifically where we need to respond to. But again, you're not obligated to give contact information, whether it's an email or phone number, but they may ask you for that. So that's, like I said, another way to contact. And if you just have general questions about occupational health and safety, feel free to send us an email or to call the toll-free number. Or if you want to, for your small business, if you want to schedule, a session with me about a particular topic, you can contact the safety branch as well. So that's everything for me, Megan. I'm just going to stop sharing my screen there. And if anybody, I just want to thank everyone for your time and your interest and your attention.